So diabetes isn't just a physical condition. It has emotional impacts and consequences. And so people with diabetes really need help with their mental health. It's very demanding. And so people with diabetes are more at risk of an eating disorder because there is a lot of focus around food in the management of it and attention to weight. And it's very demanding and become overwhelming and impact mental health. So it's been really great to be able to combine the two services, so the diabetes and the eating disorder services together. It's been a massive learning curve for myself, but it benefits the patients as well because we've been able to do joint appointments. So they're getting expertise from both services at the same time, which is really, it hasn't been done before.
And what we have now is we have a system where individuals have access to both people with diabetes, experienced people, diabetes specialists, and also eating disorder specialists in the same session.
Right.
So any questions, any queries about either side can be dealt with by the two professionals in the room and the individual themselves. Okay. So it's actually meaning that they don't have to have two separate appointments, that they're not finding that the diabetes problem is cropping up in the eating disorder appointment and the eating disorder is cropping up in the diabetes appointment. Sure. And also that we're using appropriate communication skills to allow them to talk about what is an incredibly difficult, incredibly embarrassing, shameful situation that they're in. We hear about how guilty they feel about the perception of their failure to control their diabetes, and we hear about how they avoid appointments because of that guilt, and how actually having the opportunity to be accepted as someone who is struggling with two very difficult conditions and not have that guilt around them is making it easier for them to talk about it and maybe start to make some small changes that make a difference.
So we've had a particular lady that came through. She lost an awful lot of weight, and we were noticing it, and then she felt comfortable enough to be able to open up. We linked with the teams, we did joint appointments. She actually even had a stay on the eating disorders unit with diabetes input while she was in the unit. And she's come out and she's on her road to recovery, and it's absolutely wonderful to see how well she is now compared to at the beginning of her journey. Oh. It's not a quick fix, it's very a long recovery, and it's a roller coaster for them.
It's really been about opening up the communication and allowing people to talk about the things that they feel ashamed of and feel guilty about, and know that they're not being judged for it. The idea that eating disorders and diabetes are two separate conditions, you know, for a great number of people, they're not. They are interwoven. We live in a diet obsessed society.
The patients will still need to be seen, and they will still need to be seen by both services. And I think the fact that we've now built those relationships within the two teams, that will continue. And I think throughout this, we've developed education programs. So all of that, we've done a lot of education with different healthcare professionals to raise awareness, because it's not necessarily very well recognised. So I hope that we've raised awareness so that people will get picked up and not suffer alone. And that we've set in place a pathway for referral, but also for treatment, because there isn't an awful lot known about this condition. So we've been learning as we've been going along, and we've got some idea now of how to treat the two conditions together, because the treatment for an eating disorder is very different to how you would treat diabetes. So it's finding a middle ground for the treatment. So we've come up with a plan for that, which we can take away from the project.
I would very much like to think that from this, we we are able to educate people with type 1 diabetes and eating disorders that they are accepted, that they can talk about their issues, that they can say, I can't do this, and be accepted for doing that. And that the professionals around them have an understanding that actually they're doing the very best they can when something really, really difficult, and it's our job to help them to perhaps have some skills to do a little better.